USA Football Certification newest. Question 1. What is the core philosophy of USA Football regarding suspected concussions? Option A, play through the pain. Option B, when in doubt, sit them out. Option C, only sit out if they lose consciousness. Option D, apply ice and return to play. The correct answer is option B, when in doubt, sit them out. USA Football emphasizes that any player suspected of a concussion must be removed from play immediately and not return until cleared by a medical professional. Question 2. During the first 5 days of practice, what is the focus of the acclimatization period? Option A, heavy conditioning. Option B, maximum speed drills. Option C, gradually introducing heat and physical exertion. Option D, full contact scrimmaging. The correct answer is option C, gradually introducing heat and physical exertion. The acclimatization period is designed to prevent heat-related illnesses by allowing the body to adjust to environmental stress. Question 3. How many fingers should fit between the player's eyebrows and the top of the helmet? Option A, 1 finger. Option B, 2 fingers. Option C, 3 fingers. Option D, 4 fingers. The correct answer is option B, 2 fingers. A properly fitted helmet should sit approximately 1 inch, 2 finger widths, above the eyebrows to protect the frontal bone. Question 4. Which level of contact is defined as full speed where players are not taken to the ground? Option A, air. Option B, bags. Option C, control. Option D, thud. The correct answer is option D, thud. In thud contact, players move at full speed and initiate contact but do not complete the tackle or take the opponent to the ground. Question 5. What is the first step of the heads-up tackling progression? Option A, the breakdown. Option B, the shoot. Option C, the rip. Option D, the wrap. The correct answer is option A, the breakdown. The breakdown is the foundational athletic stance that provides balance and readiness for all football movements. Question 6. Which condition is characterized by a body temperature over 104 degrees Fahrenheit and altered mental status? Option A, heat exhaustion. Option B, heat cramps. Option C, exertional heat stroke, as. Option D, sunburn. The correct answer is option C, exertional heat stroke, as. As is a medical emergency. The defining factors are a high core temperature, 104 degree F, and central nervous system dysfunction. Question 7. True or false, a player can return to the same game after being removed for a suspected concussion if they say they feel better? Option A, true. Option B, false. The correct answer is option false. No player removed for a concussion can return to play on the same day, regardless of how they claim to feel. Question 8. In shoulder-led tackling, where should the player's head be placed? Option A, in front of the ball carrier. Option B, across the chest. Option C, to the side, near side, of the ball carrier, behind the shoulder. Option D, directly in the center of the abdomen. The correct answer is option C, to the side, near side, of the ball carrier, behind the shoulder. Placing the head to the side reduces the risk of head-to-head contact and ensures the shoulder is the primary point of impact. Question 9. What is the primary sign of sudden cardiac arrest, SCA, in a player? Option A, heavy breathing. Option B, unresponsiveness and abnormal gasping, agonal gasping. Option C, a broken bone. Option D, excessive thirst. The correct answer is option B, unresponsiveness and abnormal gasping, agonal gasping. SCA often involves sudden collapse and breathing that looks like gasping or snoring, which should not be confused with normal recovery breathing. Question 10. Which level of contact involves no contact with another player or a dummy? Option A, air. Option B, bags. Option C, control. Option D, live. The correct answer is option A, air. Air is the lowest level, where players run through plays or drills without any opposition or equipment contact. Question 11. When fitting shoulder pads, which muscle should be completely covered by the arch of the pads? Option A, the bicep. Option B, the pectorals. Option C, the deltoids. Option D, the abdominals. The correct answer is option C, the deltoids. Shoulder pads must cover the deltoids to protect the joint and surrounding bone from direct hits. Question 12. What does the L in the HELP acronym for heat illness prevention stand for? Option A, listen. Option B, learn. Option C, location. Option D, liquid. The correct answer is option D, liquid. HELP stands for hydration, environmental monitoring, lack of acclimatization, and proper emergency planning. Question 13. In the bridge component of blocking, where should the hands be positioned? Option A, on the opponent's helmet. Option B, thumbs up with palms out on the opponent's chest. Option C, hands behind the back. Option D, swinging at the legs. The correct answer is option B, thumbs up with palms out on the opponent's chest. The bridge uses the palms as the primary contact point on the defender's torso, maintaining inside hand position. Question 14. What is the recommended treatment for a player suspected of exertional heat stroke? Option A, give them a sports drink. Option B, fan them with a towel. Option C, cold water immersion, cool first, transport second. Option D, walk them to the car. The correct answer is option C, cold water immersion, cool first, transport second. Cold water immersion, ice bath, is the gold standard for rapidly lowering core temperature before the player is transported to the hospital. Question 15. How often should a player's helmet fit be checked during the season? Option A, only on the first day. Option B, once at the end. Option C, every day, routine check. Option D, only after a loss. The correct answer is option C, every day, routine check. Helmets should be checked daily for proper inflation, secure chin straps, and overall integrity. Question 16. What is the shoot in tackling/blocking terminology? Option A, throwing the ball. Option B, forceful hip explosion from a coiled position into the opponent. Option C, running as fast as possible. Option D, a celebratory dance. The correct answer is option B, forceful hip explosion from a coiled position into the opponent. The shoot involves the lower body providing the power for the tackle or block through hip extension. Question 17. A face mask check ensures the mask is how many finger widths away from the nose? Option A, 1, Option B, 2, Option C, 3, Option D, 4. The correct answer is option C, 3. The face mask should be 2 to 3 finger widths away from the tip of the nose to prevent the mask from hitting the nose on impact. Question 18. What is the maximum amount of live contact USA football recommends per week during the season? Option A, 15 minutes. Option B, 30 minutes. Option C, 60 minutes. Option D, unlimited. The correct answer is option C, 60 minutes. USA Football recommends limiting full speed, full contact, live, to 60 minutes per week to reduce subconcussive hits. Question 19. Which of the following is a return to play stage for concussions? Option A, full contact on day 1. Option B, non-contact aerobic exercise. Option C, maximum weight lifting. Option D, playing a different sport. The correct answer is option B, non-contact aerobic exercise. The gradual return to play protocol begins with light aerobic activity and progresses only if symptoms do not return. Question 20. What is the rip in the tackling progression? Option A, tearing the jersey. Option B, an upward uppercut motion with the arms during the wrap phase. Option C, a lateral step. Option D, a defensive penalty. The correct answer is option B, an upward uppercut motion with the arms during the wrap phase. The rip ensures the arms wrap tightly around the ball carrier and prevents the head from dipping down. Question 21. When using an AED, what is the first step once the device is present? Option A, apply the pads. Option B, turn it on. Option C, tell everyone to clear. Option D, press the shock button. The correct answer is option B, turn it on. Turning the device on is always the first step to enable voice prompts. Question 22. What is passive hydration? Option A, drinking water when thirsty. Option B, scheduled water breaks every 15 to 20 minutes regardless of thirst. Option C, only drinking after practice. Option D, drinking soda. The correct answer is option B, scheduled water breaks every 15 to 20 minutes regardless of thirst. Coaches must provide scheduled, mandatory water breaks because thirst is a late indicator of dehydration. Question 23. In a controlled drill, what is the finishing requirement? Option A, taking the player to the ground. Option B, full-speed collision. Option C, the initiator stays on their feet and the drill ends with a rap, no ground contact. Option D, no contact allowed. The correct answer is option C. The initiator stays on their feet and the drill ends with a rap, no ground contact. Controlled drills allow for technique work at speed without the injury risk of going to the ground. Question 24. Which type of stance is used for alignment in the heads-up program? Option A, 2-point, 3-point, or 4-point depending on the system. Option B, only standing. Option C, seated. Option D, only 3-point. The correct answer is option A, 2-point, 3-point, or 4-point depending on the system. USA Football teaches all stances with an emphasis on a flat back and eyes up to avoid leading with the crown of the helmet. Question 25. If a player collapses from SCA, how soon should CPR and an AED be used for the best chance of survival? Option A, within 1 hour. Option B, within 20 minutes. Option C, within 3 to 5 minutes. Option D, only after the ambulance arrives. The correct answer is option C, within 3 to 5 minutes. Survival rates for SCA drop significantly every minute that passes without intervention. Question 26. What is the near foot concept in tackling? Option A, the foot furthest from the ball carrier. Option B, the foot closest to the ball carrier at the moment of contact. Option C, hopping on one foot. Option D, running in place. The correct answer is option B, the foot closest to the ball carrier at the moment of contact. The near foot should be planted to provide the power base for a shoulder-led strike. Question 27. When fitting a helmet, what should happen when the player shakes their head no? Option A, the helmet should spin. Option B, the skin of the forehead should move with the helmet. Option C, the helmet should fall off. Option D, the helmet should make a rattling noise. The correct answer is option B, the skin of the forehead should move with the helmet. If the helmet moves independently of the skin, it is too loose and needs further inflation or a smaller size. Question 28. Which of the following is not an indicator of heat exhaustion? Option A, profuse sweating. Option B, dizziness. Option C, loss of consciousness with 106 degrees Fahrenheit temperature. Option D, nausea. The correct answer is option C, loss of consciousness with 106 degrees Fahrenheit temperature. Loss of consciousness and extreme temperature are signs of heat stroke, more severe than exhaustion. Question 29. What is the purpose of the jaw pads in a helmet? Option A, to make the player look tough. Option B, to ensure the helmet is snug against the face to prevent side-to-side shifting. Option C, to help the player chew gum. Option D, to protect the ears only. The correct answer is option B, to ensure the helmet is snug against the face to prevent side-to-side shifting. Jaw pads must be firm against the face to stabilize the helmet during lateral impacts. Question 30. USA Football's blocking progression includes which of the following? Option A, headbutt. Option B, slam. Option C, bridge. Option D, punch. The correct answer is option C, bridge. The bridge is the technical term for the controlled engagement of the hands/arms with the opponent's torso. Question 31. What is the crown of the helmet? Option A, the side. Option B, the very top of the helmet. Option C, the face mask. Option D, the chin strap. The correct answer is option B, the very top of the helmet. Leading with the crown, top, of the helmet is the most dangerous technique and is the primary cause of neck injuries. Question 32. In the wrap phase of tackling, where should the hands be? Option A, in the tackler's pockets. Option B, grabbing the ball carrier's jersey and clamping the arms around the thighs/buttocks. Option C, on the ball carrier's head. Option D, waving in the air. The correct answer is option B, grabbing the ball carrier's jersey and clamping the arms around the thighs/buttocks. A high, tight wrap is essential for finishing a safe and effective tackle. Question 33. What is agonal gasping? Option A, fast, healthy breathing. Option B, a sign of cardiac arrest, characterized by labored, infrequent gasps for air. Option C, sneezing. Option D, a type of asthma. The correct answer is option B, a sign of cardiac arrest characterized by labored, infrequent gasps for air. Gasping is often mistaken for normal breathing but is actually a reflex during SCA. Question 34. During bags level contact, who is the initiator? Option A, the player. Option B, the coach. Option C, the bag holder. Option D, the official. The correct answer is option A, the player. In bags, the player initiates contact against a handheld bag or shield moved by another player or coach. Question 35. Which part of the body provides the power in a heads-up block? Option A, the head. Option B, the lower body, hips and legs. Option C, the neck. Option D, the hands only. The correct answer is option B, the lower body, hips and legs. All football power is generated in the lower body and transferred through a stable core. Question 36. When checking the chin strap, it should be option A, loose enough to slide a hand under. Option B, centrally located and snug enough to keep the helmet in place during a hit. Option C, tied in a knot. Option D, removed during practice. The correct answer is option B, centrally located and snug enough to keep the helmet in place during a hit. A loose chin strap allows the helmet to fly off or shift, exposing the head to injury. Question 37. What is secondary impact in a concussion? Option A, the hit that caused the injury. Option B, a second hit to the head before the first injury has healed, leading to second impact syndrome. Option C, a hit to the leg. Option D, a hit in the next game. The correct answer is option B, a second hit to the head before the first injury has healed, leading to second impact syndrome. Second impact syndrome can be fatal or lead to permanent brain damage. Question 38. A near shoulder strike means. Option A, using the shoulder closest to the ball carrier. Option B, using the opposite shoulder. Option C, using the top of the head. Option D, using the chest. The correct answer is option A, using the shoulder closest to the ball carrier. Near shoulder contact keeps the tackler's body in balance and the head out of the way. Question 39. What is the Z in eyes up teaching? Option A, looking at the scoreboard. Option B, the body profile, knees bent, back flat, chin up, that resembles a Z. Option C, Z pattern running. Option D, a sleep signal. The correct answer is option B, the body profile, knees bent, back flat, chin up, that resembles a Z. The Z position ensures the player is in an athletic, safe posture for contact. Question 40. True or false, dehydration can make a player more susceptible to heat stroke. Option A, true. Option B, false. The correct answer is option true. Lack of fluids prevents the body from sweating effectively, which is the primary way it cools itself. Question 41. If a player has a stinger, burning sensation in the arm, they should. Option A, ignore it and keep playing. Option B, be evaluated for a potential neck or nerve injury and sit out until symptoms clear. Option C, rub their arm and return next play. Option D, apply heat to the neck. The correct answer is option B, be evaluated for a potential neck or nerve injury and sit out until symptoms clear. Stingers involve the brachial plexus nerves and can indicate more serious underlying issues if they recur. Question 42. What is the strike in blocking? Option A, a baseball term. Option B, the initial contact made with the palms during the bridge. Option C, a penalty. Option D, a long pass. The correct answer is option B, the initial contact made with the palms during the bridge. The strike must be delivered with inside hand placement for maximum control. Question 43. Which level of contact is used to practice finishing a tackle all the way to the ground? Option A, air. Option B, bags. Option C, control. Option D, live. The correct answer is option D, live. Live is the only level where a player is fully tackled to the ground. Question 44. What is wet bulb globe temperature, WBGT? Option A, a measure of water temperature. Option B, a composite temperature used to estimate the effect of temperature, humidity, and solar radiation on humans. Option C, the weight of a football. Option D, a type of cloud. The correct answer is option B, A composite temperature used to estimate the effect of temperature, humidity, and solar radiation on humans. WBGT is the standard for determining when it is too hot/humid to practice safely. Question 45. When fitting a helmet, if the ear holes do not line up with the player's ears, option A, the player has small ears, option B, the helmet is the wrong size or not properly adjusted, option C, the player should wear a hat, option D, it doesn't matter. The correct answer is option B, the helmet is the wrong size or not properly adjusted. Ear holes must align for safety, hearing, and to ensure the helmet is sitting level on the head. Question 46. The drive phase of a block requires, option A, standing straight up, option B, short, powerful steps to move the defender, option C, stopping after contact, option D, closing the eyes. The correct answer is option B, short, powerful steps to move the defender. The block is not finished until the defender is moved or the whistle blows. Question 47. What is the three-point stance? Option A, standing on three legs, option B, a stance where the player has 2 feet and one hand on the ground, option C, a stance for kickers, option D, a celebration. The correct answer is option B, a stance where the player has 2 feet and one hand on the ground. Linear and balanced three-point stances are taught with an emphasis on keeping the head up. Question 48. What is the standard hand cleanliness rule in USA football to prevent infections, MRSA? Option A, wash once a week. Option B, shower and wash all gear regularly, and report any skin rashes immediately. Option C, only use hand sanitizer. Option D, no rule exists. The correct answer is option B, shower and wash all gear regularly, and report any skin rashes immediately. Skin-to-skin contact and shared equipment make hygiene critical for preventing bacterial outbreaks. Question 49. A shoulder-led block is used to, option A, headbutt the defender, option B, drive through a defender using the shoulder as the primary contact point, e.g. lead blocking, option C, kick the defender, option D, trip the defender. The correct answer is option B, drive through a defender using the shoulder as the primary contact point, e.g. lead blocking. Shoulder-led blocking, like tackling, prioritizes head safety by using the shoulder as the tool. Question 50. What is the one-on-one rule in abuse prevention? Option A, 1 coach per team. Option B, coaches should never be alone with a single player in a private setting. Option C, players must work alone. Option D, 1 ball per player. The correct answer is option B, coaches should never be alone with a single player in a private setting. USA football and SafeSport require a 2-deep leadership model to ensure child safety. Question 51. Which muscle group is used to maintain eyes up during contact? Option A, biceps. Option B, abdominals. Option C, neck extensors, trapezius. Option D, hamstrings. The correct answer is option C, neck extensors, trapezius. Strong neck muscles are vital for keeping the head up and preventing the chin-to-chest posture that leads to injury. Question 52. What is the B in the ABCs of first aid for SCA? Option A, bleeding. Option B, breathing. Option C, back up. Option D, balance. The correct answer is option B, breathing. The priority in SCA response is airway, breathing, and circulation, compressions. Question 53. In the wrap stage, the tackler should grab what part of the jersey? Option A, the neck. Option B, the shoulder pads. Option C, the back/thigh area of the jersey to pull the ball carrier in. Option D, the face mask. The correct answer is option C, the back/thigh area of the jersey to pull the ball carrier in. Grabbing the jersey during the wrap helps control the ball carrier's center of gravity. Question 54. True or false, mouth guards are primarily designed to prevent broken teeth. Option A, true. Option B, false. The correct answer is option true. While some claim they prevent concussions, their primary, proven role is dental and jaw protection. Question 55. When is air contact most useful? Option A, during the Super Bowl. Option B, during the walkthrough or initial learning of a play. Option C, during a live scrimmage. Option D, only for the punter. The correct answer is option B, during the walkthrough or initial learning of a play. Air contact allows players to focus on their assignment without physical distraction. Question 56. The center of gravity in a football stance should be: Option A, on the heels; Option B, over the balls of the feet with a balanced base; Option C, on the fingertips; Option D, in the air. The correct answer is Option B, over the balls of the feet with a balanced base. Proper weight distribution is key to the breakdown and all starting stances. Question 57. What should a coach do if a player is hyperventilating from anxiety? Option A, give them an inhaler. Option B, use a calm voice and help them slow their breathing, then refer to medical staff if needed. Option C, yell at them to focus. Option D, make them run laps. The correct answer is Option B, use a calm voice and help them slow their breathing, then refer to medical staff if needed. Coaches should recognize signs of psychological stress and provide basic support. Question 58. Which document should every coach have at every practice? Option A, the team's win-loss record. Option B, an emergency action plan, EAP, and player emergency contact info. Option C, the latest NFL news. Option D, a signed jersey. The correct answer is Option B, an emergency action plan, EAP, and player emergency contact info. The EAP ensures the coach knows exactly what to do and who to call if a life-threatening injury occurs. Question 59. When performing the rip during a tackle, the arms should move. Option A, downward. Option B, in a circular motion toward the sky, uppercut. Option C, behind the back. Option D, in a punching motion. The correct answer is Option B, in a circular motion toward the sky, uppercut. The rip creates a powerful hug that secures the tackle. Question 60. What is the heads-up way to describe a player's line of sight? Option A, looking at the ground. Option B, eyes up, chin up. Option C, eyes closed. Option D, looking at the sideline. The correct answer is Option B, eyes up, chin up. Keeping the eyes and chin up naturally puts the spine in its strongest, safest alignment.